Welcome to the Medical Corner. Our today's topic of discussion is pneumonia. It is one of the most important and the most common bacterial infection of the lungs. So, starting with it, pneumonia, it is the terminal respiratory tract infection. As we know, our respiratory tract starts from the nose up to the alveoli. So it is the terminal respiratory tract infection. It is not infection of the nose. It is not the infection of the trachea. It is not the infection of right and left main principal bronchi. It is the terminal respiratory tract infection which is distal to the right and left main principal bronchi. So in pneumonia, the main structure which is involved is our alveoli. As we know, alveoli is the basic structural and the functional unit of our respiratory system. So what happens in the pneumonia, that the alveoli is filled up with the water, brings water into the alveoli. So this is the basic problem which happens in the pneumonia, that our alveoli are filled, or this alveolar sac get filled with the water or the exudate. How all this happened? Now talk about it. As we know, the basic function of the respiratory tract is gaseous exchange. We are inhaling oxygen, we are exhaling carbon dioxide. Side by side, we are also inhaling the microbes. There is also microbial exchange right there. So whenever there is microbial entry into our body, so first they have to cope up with our protective mechanisms of that systems. So in respiratory tract, the basic protective mechanisms are: number one, coughing, mucociliary reactions; number three, immune backup, that is macrophages and immunoglobulins; nasopharyngeal filtering actions. As we know, at the entry point of the larynx, right there, there are lymphoid tissues like adenoids and tonsils, which are there to protect the respiratory tract from the microbes. So when a microbe override all these protective systems, this microbe get lodged and colonize bronchi or the alveoli. Whenever microbe override or the bypasses or protective mechanisms, the microbe got the opportunity to enter into our respiratory tract. So when this microbe get lodged and colonize the bronchi or the alveoli, so there is inflammatory response. And whenever there is inflammatory response, as we know, the basic structure which is involved in the inflammatory responses are white blood cells. So when there is inflammatory response, right, there is accumulation or the formation of exudate into the alveoli, and this exudate consists of white blood cells, proteins, fluids, and red blood cells. So this is the basic point from where the problem begins, which is known as pneumonia. So in pneumonia, what happens? Our alveoli get filled up with the water or the exudate, which occurs as a result of inflammatory response. So this is all about the introduction of the pneumonia. Now we move on to its details. So now move on to its causative organisms. So the main organisms which can cause pneumonia, these are viruses, bacteria, and the fungi. So starting with the viruses which can cause pneumonia: number one, influenza virus, and second one is COVID-19. Bacteria are the most common causes of the pneumonia. So now move on to the bacteria. The bacteria which can cause pneumonia, number one is Streptococcus pneumoniae, H. influenzae, Staph aureus. These are the most common strains or the most common bacteria which can cause pneumonia. Other bacteria are the Mycoplasma pneumoniae, Chlamydia pneumoniae, and the Legionella pneumoniae. All these produce the walking pneumonia because they also produce other symptoms beside the pneumonia. They also produce fatigue and the general illnesses. The fungi which can cause the pneumonia, these are the histoplasmosis and pneumocystitis pneumoniae, and these are the least common cause. Fungi are the least common causes of the pneumonia. So all these are the causative organisms of the pneumonia. So now we move on to its classifications. So pneumonia can be community acquired or the hospital acquired. In community acquired pneumonia, the person gets infected in the community or from any other person. So such type of pneumonia is community acquired pneumonia. Second one is hospital acquired pneumonia. When a patient get admitted into the hospital for any other problem or any other disease and he gets the pneumonia. So such pneumonia is hospital acquired pneumonia, and it is usually more resistant and the most serious. And the most common organisms which is there in the hospital acquired pneumonia is the Staph aureus. As we know, one of the most common resistant strain of the Staph aureus is methicillin resistant Staph aureus. So, next one is the aspiration pneumonia. Aspiration pneumonia is there when there is wrong pipe entry. For example, entry of the foods, drinks, or the gastric contents into the respiratory tract. So this type of pneumonia is known as aspiration pneumonia. When we aspirate gastric contents, drinks, foods, or any other materials into our respiratory tract. So when we aspirate gastric contents, drinks, foods, these are the not sterile, they contain the bacteria. So when such contents or the such things enter into the respiratory tract, they can also produce the pneumonia. So now move on to its further classification, which based on the location. So number one is the bronchopneumonia. Bronchopneumonia, which is when it involves whole bronchial tree. Second one is interstitial pneumonia, when there is the exudate formation or when there is the problem between the alveolar spaces. Third one is the lobar pneumonia. Lobar pneumonia is when it involves whole lobe. As we know, our lung consists of the various lobe. So when whole one lobe is infected, we call it lobar pneumonia. So there are the various stages when usually whole lobe is affected or infected. So there are the 4 stages. Our immune system tries to get rid of the bacteria. So in the lobar pneumonia, these 4 stages starts to get rid of the bacteria. So the number 1 stage is the congestion stage, which starts usually within 1 to 2 days. In congestion stage, blood vessels and the alveoli dilated. When blood vessels, alveoli and the capillaries are dilated, so there are increased blood flow. So when there is increased blood flow, there is increased recruitment or there is increased concentration of the white blood cells, lymphocytes and other immune cells. So this is the number 1 stage, congestion. Second one is red hepatization. As you know, blood vessels and the capillaries are the dilated, there is increased blood flow, so there is red color appearance after that lobe. Red hepatization, hepatic means liver, the liver appearance is red, so that's why we call here is the red hepatization. It usually begins within 3 to 4 days, and there is increased exudate formation because there is increased white blood cells, lymphocytes and neutrophils are there. So next stage is the gray hepatization. So it is a stage when there is resolution of the infection. So gray hepatization, it begins usually within day 5 to 7, and this is the stage when RBCs starts breakdown. Next stage is the resolution stage, it is the clearance stage, and it usually takes 8 to 3 weeks to get rid of the microbe. So now we jump to its symptoms. So the main symptoms is the productive cough. So pneumonia, the main symptom which patient complains is the protective cough. Second one is the dyspnea, which is shortness of the breath. Chest pain is also there. Fatigue and fever is also there. So how we can diagnose the pneumonia? Number 1, the patient has difficulty in breathing. Second, history is important. For example, if the patient gives the history of the bedridden for the past few years, and in case of aspiration pneumonia or the chronic respiratory tract infections, the chances of the pneumonia usually increases. Third one is the chest X-ray. We use the chest X-ray for the diagnosis of the pneumonia. And usually the chest radiograph shows mottled focal opacities in both the lungs, chiefly in the lower zones. So the chest X-ray is also important. Dullness to the percussion, which we know when we do the examination. And second, last one is breath sounds. These are also important. So these are the few points on the basis of which we can diagnose the pneumonia. So jump to its treatment. The treatment includes antibiotics, cough suppressants, pain medications, and the symptomatic treatment. So if the resolution does not eliminate the bacteria which is causing the pneumonia, so pneumonia can cause further complications, and the complications include organization. What is organization? In organization, there is ingrowth of the fibroblast from the alveolar septa, which is resulting in the tough, airless, leathery lung tissues. So, this is the number one complication if we can't get rid of the microbe. Second one is the pleural effusion. 5% of the treated cases of the lobar pneumonia develops inflammation of the pleura with effusion, but sometimes it may also undergo organization with fibrous adhesions between visceral and the parietal pleura. Next one is the empyema. Less than 1% of the treated cases of the lobar pneumonia develop encysted pus in the pleural cavity, which is known as empyema or pus in the pleural cavity. Next one is the lung abscess. This is the rare complication when there is other or the secondary infection by the other organisms. Last one is the metastatic infections. So, occasionally, infection in the lungs and the pleural cavity in the lobar pneumonia may extend into the pericardium and the heart, causing the purulent pericarditis. So, other forms of the metastatic infections encountered rarely in the lobar pneumonia are the otitis media, meningitis, brain abscess, and the purulent arthritis. All these complications can happen if we can't get rid of the microbe at our earliest. So this is all about the pneumonia. Hope you enjoy the video. Subscribe our channel for more videos related to the diseases. Thanks for watching.